Hi, my name is Lydia Habib, and I'm a health educator at the University of New England, and it's my pleasure to be presenting today presentation to the Bill and Melinda Gates Foundation in regard to suicide rates in young girls in the United States. Economic and social fluctuations are two major contributors to mental and physiological changes among young girls in the US, and as a result, rates of suicide among this age group is the highest. Adolescents and young girls ages 10 to 14 years old in the United States are the main affected population from my health issue. Suicide was the second leading cause of death among young people aged 10 to 34 years old in 2016. And for the same year, suicide rates among adolescents were 13.15%. Statistics showed that in 2016 only 45,000 individuals took their own lives. Also, as noted by the National Institute of Mental Health, that there were more than twice as many suicides in the United States as there were homicides. Rates of suicide were higher for female in the American Indian, Alaska Natives, and white non-Hispanic groups. There is a nationwide 12-month survey showed that 16% of high school students consider suicide, while 13% created a plan to take their own lives and 8% tried to commit suicide. Young adults and teenagers' suicide rates have rapidly increased in the recent years. There are many risk factors that lead to young girls to commit suicide. Some of them are genetics, family history, lack of social support during difficult times, depression and anxiety, any form of abuse, physical, sexual, or verbal, harassment at workplace or at schools, bullying, and cyberbullying. Applying the socio-ecological model to my case study. On the individual level, helping factors will be enhancing young women's knowledge about suicide risk factors, possible treatments, and available counseling in early stages. Through suicide awareness programs, using professional lectures, recovering patients, and celebrities with successful stories. Hindering factors will be gender inequality at schools, also children bullying and cyberbullying are major factors when it comes to youth committing suicides. As noted by the American Academy of Pediatrics, one study found children and teens who were cyberbullied were roughly 3 times more likely than peers to have suicide thoughts. Interpersonal level. Helping factors will be being surrounded by supporting and understanding family. Family plays a huge role in either detecting suicide risk factors in early stages or providing the needed support to the children during treatment and recovery stage. Hindering factor will be the fear of feeling prejudged against. Children with mental illness or other risk factors can lead to suicide. In most cases, has a low or no self-esteem, leaving them vulnerable to the fear of being judged or discriminated against. Organizational level. Helping factor will be accessibility to good quality healthcare. Individuals who have affordable access to healthcare show better rates of recovering from depression and anxiety and other mental illnesses as they seek help in early stages. Hindering factor here will be unavailability of health insurance. Research showed that individuals with no health insurance are more likely to ignore treatment and may not seek help at all, and in many cases, their mental illnesses go undiagnosed until it reaches a very serious stage. Community level. Helping factor. The media's role in spreading awareness in the past decade or two, different media outlets had a great role in spreading awareness regarding available mental health programs, resources, and treatment options to both patients and families. Hindering factor here will be community attitude and victim shaming. Especially rape victims might find it hard to come forward and seek help. Policy level. Helping factor here will be in enacting state policies that mandate insurance companies to cover mental health preventive services at no charge. This will ensure access to needed service to each child regardless of their socioeconomic status, education, gender, or race. Hindering factor will be lack of proper laws or policies that prevent gender inequality and cyberbullying in different life settings. Proposed intervention. I believe prevention is very important, especially in suicide among young girls in the United States. Prevention can be achieved through establishing awareness programs in high risk communities in partnership with different community leaders, organizations, school, universities, and other community based partners. In the past, awareness and prevention programs showed promising results in lowering and controlling different suicide risk factors among adults and girls. Also, partnering with different media outlets to run awareness commercials on different available resources to those who feel down or thinking of suicide. Suicide rates are rapidly increasing among young adults, and early screening in schools, primary care clinics, and emergency departments can be a great intervention method to prevention. Early screening of different risk factors like depression and anxiety and bipolar disorders can lead to suicide and can highly be beneficial in prevention. Research showed that between 59 and 87% of suicide victims suffered from major depression, while up to 15% of these patients will eventually commit suicide. Another proposed intervention will be establishing local suicide 24/7 hotlines and text messages for high risk communities. The availability of such hotlines will provide parents, close friends, and school officials the facility to report risky behaviors for someone in crisis. Suicide thoughts and actions are a huge sign of suicide, and they should never be ignored. For each step of the intervention, evaluation will be carried out according to three measures, which are process measures, impact measures, and outcome measures. Questions like how many girls who show suicide risk factors enroll in the program after the first program launch? Or do callers feel the line helped them? And would they refer friends and family to make use of this line? And what is the change in attempt suicide rate in each school where the program is implanted will be used to gather insights. Data will be collected through surveys, focus groups, follow-up questionnaires, partners database, and health department patient records to establish trends and prevalences. Potential challenges: social barriers, community norms and behaviors toward mental illness, lack of access to mental health services, communities' inability to identify suicide risk factors in early stages. Possible solutions will be spreading awareness through media outlets and school meetings, working with local hospitals, providers, and community partners to provide free screening services to communities with lower accessible resources. For my intervention project, all inputs will be provided through partnerships with different community partners, funding to support different activities, and data provided by health departments, schools, and other official departments. Activities will include suicide prevention programs, suicide screening, and establishing and promoting 24/7 support lifeline. Assumed results will involve encouraging target population to seek help, identifying high-risk groups and individuals, and providing access to different preventive services. Expected outcomes should include more individual seeking health and screening in early stages, and more community involvement to achieve better results and to attract more young girls to be part of the movement toward better mental health and lower suicidal rates. At the end, the overall goal of this project is to lower suicide rates among girls and young women. Here are my references. Thank you so much.